Hi, this is Ambrina. I'm presenting a 2.5-year-old child presented to the clinic for earache, fever lasting for 2 days, nasal congestion, and decreased appetite. Father is the primary historian. Father also reports developmental delays hinting towards autism, although not formally diagnosed. So the patient is a 2.5-year-old child presenting with 2 days history of fever. The father reports nasal congestion and the child pulling and tugging at the right ear. There are no other concerns. The child does not take any medication, but the father has been giving him Tylenol for pain control. There's no contributing family history. The child attends daycare. On physical exam, the child is alert and looking at the iPad, and the headphones are on. On otoscopic exam, both ears show erythematous tympanic membrane with some bulging. Heart rate is regular, breathing is regular as well. My differential diagnoses include otitis media, acute otitis media with effusion, and otitis externa. My primary diagnosis is acute otitis media because of physical finding of erythematous tympanic membrane and bulging, along with fever and loss of appetite. Otitis externa was considered since the patient has ear pain, but it is less likely because the ear canal is not inflamed. Otitis media with effusion is another possibility, but less likely because it does not present with fever or pain. My question for the preceptor include coaching on effective techniques on how to communicate with the toddler, especially with developmental delays. Second question is how to engage a child in medication regimen, since the father expressed concern over oral route of medication. My plan is to start the child on amoxicillin, 90 milligram per kilogram per day, and continue Tylenol for pain control as needed every 4 to 6 hours. Ensure proper hydration. Keep the child out of daycare for a few days. If the fever worsens or child gets lethargic or dehydrated, take him to an urgent care. If the fever doesn't resolve in 48 hours, come back to the clinic. Otherwise, we will schedule a 7-day follow-up, and then we can also discuss referral to a developmental evaluation. Or learning issue that is identified is learning different communication techniques with children, especially with developmental delays, and techniques that can help parents help the child take the medication. Thank you so much.